Haniel Haruna Hadise, the Director of Studies at Nigerian Customs Command and Staff College, domiciled at Bogolada. I'm also here with my colleague, Deputy Controller. He's a medical doctor. He's a fellow of Defense College. I want to thank the leadership of our forum for the opportunity to share this basic knowledge with you, my elders, so that we'll have this basic knowledge that will be of help to us, to our community, to our families, to our friends, to our colleagues at work and our business places. That is all about me and my colleague. Now, as a way of introduction, cardiopulmonary resuscitation. When you hear cardio, it's all about the heart region, heart. Cardio. Pulmonary is about the lungs, and we know what lungs does to the body, right? So it's just a combination of these two aspects. Of we don't need to go into scientific words and what have you. Just the basic, simple language. And we'll try as much as possible to keep it simple, so that at the end of the day, we're going to share ourselves into two, and we're going to have hands-on. So that we will understand the process and of cardiopulmonary resuscitation. Of course, by the literal meaning, resuscitation is to revive someone. Of course, cardiopulmonary resuscitation is administered onto someone that is gasping for breath. It's gasping for somebody that is losing breath due to some health situation, or could be during accident, domestic accident, the person improperly inhaled chemical at a factory. There are some corrosive chemicals that can collapse the heart. When you inhale, it can collapse the heart, and that could lead to cardiac arrest, and then the person will actually desire for someone to administer CPR. And like I said, it's a last resort intervention. Now, I would like all you, my elders, to look at me. Is this normal? No. Of course, something is wrong with me. I am dying, I'm traveling, and you don't want me to travel. So at this point, that's why we say is the last resort in intervention. And what I've just demonstrated is this abnormal what? Gasp. As it is most likely that this person is actually going into what? Cardiac arrest. Now, cardiopulmonary resuscitation is all about two things. Pushing, and we call it compressing the heart. Compressing, when you push hard on the chest. And we're going to show you where to place your hand, not just any hand. There is a particular point where you need to put your hands, and not just the palm. There's a particular spot in your hand that you are expected to place in a particular position. We're going to demonstrate. Everybody will have hands on it. So when we push the chest, of course, the heart helps the central nervous system to pump blood to the heart. The lungs will help. Once the chest is compressed, the heart also gets fuel. It gets fuel, just the way you use a starter. You know, we connect the cable from another battery to another battery to start up something. So that's what we are going to do to this person that is in dire need of cardiopulmonary resuscitation. Now, according to American Heart Association student workbook, basically it talks about these two things. Consists of pushing on the chest, like what I said earlier on, which is compression, and then giving what? Breath. To breath. So we're going to look at the sequence, how to administer the compression and then the breath, and then eventually the person revived. That's what we call recovery position. How you're going to lay the person, because I and you were not doctors. We have this basic knowledge, basic skill on how we can be of help to someone that is in their need of CPR. Of course, lungs. The atmosphere. The lungs helps also collect air. It looks at into this air, analyzes the air, it purifies the air, and then it goes into the bloodstream, the blood vessel. You know, when we say vessel, for custom officers, when we say vessel, our man will quickly go to ship, container. Now, same thing applies to our body. We have blood vessels. And these vessels are the transporters of blood to the central nervous system. And we're going to see why it's important for us to ensure we do not put ourselves in a position where the lungs will be affected. So, as the lecture continues, we will see all of that. This is the main cocoa. Our heart is center left. Our heart is center left. So we're going to take care of that and see where we are to place our hands during the CPR practical exercise or hands-on exercise. I'm going to be a little bit fast because this lecture is not to me, it's not the basic thing. The basic thing is for you to understand how to carry on the exercise. So I'm going to rush. The aim, of course, is to give you, my elders, the basic knowledge on how you also be a semi-doctor. Because we are not doctors yet. But because we have this, we are also part of the medical personnel. Because your duty, I and you, is to resuscitate this person. Keep the person in a recovery position before the arrival of the ambulance, before the arrival of the professionals, the doctors, the midwives, the nurses. They are professionals. So once they come, you hands up. You allow them to continue from where you started. You see, before now, when it happens, we'll say, oh, Yamutu, hey, help me. You are not supposed to do that. You are supposed to quickly administer CPR on that fellow. The time you use in running around shouting for help, that makes him gone. So that is why we're here today, for us to understand that basic skill that we can be of help to that person. For me, if I see someone in this position and I fail to carry out my duties, it's a crime as far as I'm concerned. But if I don't have the knowledge and I'm running around, of course, we're human, because you do not understand. That is why you were running around to ensure that you get the help. Now, at the end of the day, we are going to achieve that our aim for this lecture. We are going to cover these few scope items: CPR procedure, recovery position, guides to administering of CPR, challenges. Of course, there are a lot of challenges, and then health tips. Just little health tips that will help us at our own time. Excuse me. High blood pressure, yeah, it's advisable that periodically we check our blood pressure. Periodically, it's very, very important. When you know the range that you are and it's approved by a doctor that you are within a safe zone, then you are good to go. Not checking at all is the big problem. Not checking at all. Yes, for now you look healthy, but there are some underlying ailments that are just there sleeping, waiting for something to trigger it. Now, but if you visit your medical personnel, your friend who is a doctor or medical facility, periodically at your own time, not to wait until you see some signs or symptoms, but at all time we advise that you check for your blood pressure periodically, so that you understand where you are within the range, the safe zone, and then the zone that you will need some medical advice. And then diabetes, I know with age we're prone to some of these things, but it's good you identify your medical status. If you have this, once you have the knowledge, you have solved the problem by some percentage. Once you identify that I have this issue and you are open to a doctor, then remedy will be found. Where you do not have the capability or you do not see any reason to visit your doctor, then you are also helping that ailment to grow big. And when it grows big, it's your pocket that also will go slim. It's not my prayer for any of you, my elders, but it's just by way of advice that it's very important for us to visit our doctors, to always check our health status. That will actually help us to solve these problems. Obesity, alcoholism, and you know this obesity is all about lipids, and lipid is fat. And this fat, we will see it as by the time we break this into pieces. These lipids also affect the blood vessel. It goes into the inner walls of this blood vessel, and it shrinks the blood vessel. So if the quantity of blood is to flow properly at this range, but because of these fats that are inside, it shrinks the blood vessels, and a little quantity of blood goes, and that little quantity is not enough for the central nervous system to work adequately. So it's important also for us to check that. And alcoholism, I'm very sure my elders, this we can advise. You can advise us with your children that alcoholism is not good. And I'm sure even if you have done it before, by now you are either reducing it, but it's your responsibility to ensure that we, your children, grandchildren, do not participate or partake in anything that has to do with alcohol. We will see what it does also. Smoking, of course, like I said, you will only advise us, we, your children, your grandchildren, not to engage in. So these are causes of cardiac arrest. They have their own areas where old age, wear and tear the body system. And like daddy, when you were 20, 25, you play football, you run, you jog, like this staircase, and you jump up. But now, you take it dear. You take it, you walk like this, wear and tear. Now, it's not like when you buy new cars, you tear the leather, you speed. But if it is football, by then it's degrading. It will not fire again like before. It's slow and steady. And that's how your body system, all those veins, they will be weakening. And then you need special care. We pray that we children will not give you problem at this time. We'll help you enjoy yourself. We'll send money that you should go to Canada, you should go to America and enjoy. At this time, because at this time you need care. By this time you need care. Because you have done what you're supposed to do for us. So it's a give back time for us to take care of you, so that at your old age you will enjoy it well. By the time you look at us, you will say, my son, thank you. And then I will now say, Daddy, it's your investment. Thank you. Now let's start with this obese man. Obesity, like I said, it's lipids. Lipids is just fats, like I've explained this. Remember I told you that it causes the blood vessel causing it to be what? Hard. It will be hard. It will not be. It will be what? Non-elastic. So it will be strong. It will not be flexible. It will not be flexible. That's what fat does. It affects the blood vessels. It affects the flow of blood to the heart and then the brain. So when the brain does not get the right quantity of oxygenated blood, then the brain will start rebooting. It will be rebooting and rebooting and rebooting. That will not be our portion in Jesus' name. Amen. Now, body mass index is very important. Also, for you to know it's very important. I'm sorry. It's very important for us to understand our body mass index. It will help us to know whether we are overweight, underweight. If you are overweight, your doctor will tell you exercise, avoid this, do this, don't do that. And if you are underweight, he tells you do this to improve, so that you will be at the required range. So now let's look at the formula. Body mass index, the international standard of our World Health Organization is 24.9. And how do we arrive at this? This is very simple. Your weight all over your height, and then it gives you whatever thing it gives you. For underweight is 18.5, which is not good. And then for normal BMI is 18 to 24.9. And class 3, which is above 40, is life-threatening. When your body mass index is above 40, then it's life-threatening. So at that level, you are expected to visit your doctor. Please always get in touch with your doctor. Doing that will help you a lot and solve some of the medical health issue. Now, alcoholism, we've said it before, it damages what? The liver. The liver, it also destroys blood vessels, leading to what? Hypertension. It also affects the brain, leading to respiratory depression. Alcoholism. Because what you must have done at your early age, it has some kind of effect in the future. So it's good for us with children to listen to you, our parents, so that our tomorrow will not be an issue. Like this young man, now look at those, look at the bottles before him. Now, let's look at this man even at this age. Even at this age. Thank you, sir. Sorry, sir. I think I used to do what I'm saying late. So, look at this papa. Even at this age, he's still wounding himself. He's still wounding. And look at it, smoking destroys the blood vessels. Everything blood vessels. So custom officers, we don't joke with vessel. Anything that say vessel, revenue has come for the federal government. So same thing applies to our blood vessel. Same thing applies to our blood vessel. So it is important for us to adhere to some of these things so that we will live longer and enjoy the fruit of the womb and all the investment. Look at what it also destroys vital aspect of. Let's look at it. Blood vessel is number one. The heart, the brain, the kidney, the lungs, etc. If doctor comes up now, he will tell you other aspects of the damage that this cigarette does to human body. Wear and tear. I've just explained that. It's a blessing for one to get to this level, and I'll just pray that she has her grandchildren, her children taking care of her. Because at this time, like what I used to tell my students, and when I talk to them, you see them crying. When I speak to my students, and anytime this picture comes up, when I talk to them, when I tell them, look, who called this mom today? You see them everywhere with good. I said, if you have your mother like this now, or your father at this level now, you are lucky. And if you have not been calling them, and if you have not been visiting them, you have not been taking care of them, shame on you. You will see them, you will see tears. I will ask what happened. No answer. But for you already, I just pray that you have children that remember what you have done. Remember what you have done, the investment, the care, and everything. Now, procedure. For example, now, somebody just falls down, bam! Is gasping for, remember what we said during the introduction? This man is dying. This man needs help. Now he falls down, bam. We are now saying that the first process is not for you to go in there to commence CPR. First of all, assess the environment. Is the environment safe for you, the caregiver, and then the victim? What if the person steps on naked wire and got electrocuted? What if snake beats him? What if he held corrosive chemical? So for you, the caregiver, we are saying that step one, you are to ensure that the scene is safe. If the scene is not safe, may the same journey rest in peace. And just go. You don't go there and so that we don't bury two people. Yes, if the environment is not safe and that you cannot pull the person out of that scene, pray for the person and then you move on. Yes, allow the person to go. Then the next scenario, haven't access the place. The place is safe for you now. Now, haven't access the place. The place is safe for you to come in. You have to kneel down. You have to kneel down close to the person's upper part of the body. Then this thing is called collarbone, right? But the science people will say clavicle. They say clavicle. So you will tap at the person's clavicle. How does it? Can you hear me? We are trying to see if this person is alive or not. Remember, we said the only time that we can give CPR is when the person cannot breathe, and also does not have pulse. I'm going to show you where to check the pulse. And if there's no pulse and it's not breathing, so confirm that this person needs CPR. And CPR is not done on the mattress. It's not done on the couch. It's not done on the seat. It's done on a flat surface. Why do we have to put the person on the flat surface? To avoid recoil. If you do it on the bed, there's a recoil. The person goes down with the mattress and that effect will not be there. What we're trying to do, we are trying to revive the person's heart. So that's why we say chest compression. Now, if the supporting element is pillow, it will just go inside the pillow or inside the mattress. So it's advisable that that victim should be placed on a hard surface, floor particularly. So when you tap on the person's clavicle, no response. The person does not blink his eyes, does not move, there's no any sign. Then the next thing is you yell for help, you yell for help. Help! Help! Don't go and start calling doctor or police or ambulance. Don't do that. You have to remain with this victim and just shout, help! Call the doctor! Get me an AED. I'm going to show you what AED is. Or call 911. I don't know what number we have in Nigeria. That is the healing. That's the healing. But you need to shout to create awareness that you are doing something here, that you need someone to come in to support or to get actually ambulance, so that at the end of the day, a better facility will also add value to that your effort. Now, remember I said you have to kneel down. I'm going to demonstrate later. You have to kneel down on your knees, close to the person. Now, we have checked, no respiratory, nothing. We have yelled. We have ensured that the scene is safe. Now, you're going to put your cheek on the person's nose and ensure and mouth. And your eyes is looking straight to the person's chest to see rise and fall of the chest. And if the person is breathing, of course you are going to feel the oxygen that comes out either from the mouth or the nose. We are just trying to be sure that this man, we don't give this man double wahala. We want to be sure that this man is actually not breathing and there's no pulse. So we need to activate the heart as fast as we can. So you need to do all this process within a short time. Within a short time. Later on, I'm going to show you the timing, the important minutes, first few minutes. And if it exceeds that minute, the person is vulnerable. The person is vulnerable. You only waste your time. Now, femoral, all these are areas for you to check pulse. I brought this just for us to understand that you can check pulse everywhere. But it's called cardiopulmonary resuscitation. The concentration is from the chest and head, that's all. So you don't need to go to radial to check for pulse. You don't need to go to femoral and check for pulse. All we want is come to the carotid here. My elders, please put your hands here. Now I'm talking because I'm talking. My own is pounding. My own is doing boom, boom, boom. But because you are at rest, your own will go because you are at rest. So your own feeling, you don't need to press it. It's between the jaw and the neck. Between the jaw and the neck. Just put your hand here. The mona is pounding. Boom, 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 boom. So all these other aspects, you don't need to go there because you are wasting time. We don't have to waste time because this person needs help from us. Now, like I said, you have to give 30 compression. How do we do it? How do we do it? The right hand is my stronger hand. I'll use the heel of my right hand. The heel of my right hand. I'm going to lock my elbow. I'll lock my elbow. Then my left hand, the weaker hand, comes into to marry. Sorry. Yes, sir. Yes. So, if the person is alive, like that I'm feeling out now, you are like that. But if the person is not alive, I won't feel anything. That's why when you take someone to the hospital, the doctor just comes out. He doesn't even, he knows. But then he asks you, how long has this person been in this position? But then you give him, even if it's 20 minutes, 30 minutes, he knows that this was not good. He will just, inside the ambulance, he will just do like this. Like I'm feeling on that, I'm feeling your force. So in the ambulance, you just do like this, or you come here and do like this. Then you won't even tell anything. You just go. And you that brought person, you know that this one don't go. Not you like. But you know that person that ambulance is gone. So you just, that is what they write, a death on what? Do you understand? So the essence of doing that is for us to ensure that this person really needs what? CPR. You cannot do CPR on someone that is somebody that is responsive. When you pinch him, you say Kai. When you hit him, you say ah. So such people you don't administer CPR. It's for someone that is unresponsive. Unresponsive. So let me shoot off. Now, like I said, the person needs to be flat on the floor, right? Then this heel comes right here. Now, this thing is now in the chicken, the chest of the chicken. You remember when you were smaller? That biscuit bone, chest. Is that one? So we have our own. So we'll tell you not to place your hand anywhere because you can. That is like biscuit bone. You can also punch it and punch the inner organ. So what we are saying is, you look at the nipple. Now, if I lie down, you'll see my nipple. Then you can see the chest, the middle of the chest. I mean the middle of the nipple. Just put this heel in between, right? And then this other hand, I'm going to demonstrate with this mannequin. But let's just understand the basic. Once we grab the basic, the mannequin's exercise will be easier for us. So this hand comes in here. Then now for ladies, because I said nipple, right? You know, for ladies, if they lie down, if you are looking for the nipple, one nipple can go there, one nipple can go there, one nipple can go there, right? So their own nipple is deceptive. Their nipple is deceptive. You know, in the medical, we don't care about women anatomy. Do you understand? I hope I'm free to talk. So you will see yourself administering CPR on ladies. So you will see yourself doing that. What if it's your sister, your auntie, your daughter, your wife, your mother? Why will you not? You jump down quickly, you know, and administer CPR. So their own nipple is deceptive. So just put your hand in the middle. In the middle. Are we following? Yes. Just put your hand there in the middle for ladies. Then for guys like me, of course, our own is just constant. Then the strength should come from the upper part of the body. Upper part of the body. You must lay down close to the victim. Like this. The hand is up there. I think let's start using the mannequin. Doctor, let's start. You have to kneel down close to the person, right? Or should I hold the mic? So, my right. All right. Remember, the first step I said, the scene must be safe for me and the victim. The scenario must be safe, right? That is the first step, so that I don't also become a victim. So, and then the second step is for me to tap at the clavicle to ensure that this man is not breathing and the man really needs CPR. I tap him. And once that is confirmed that this man does not have pulse, I yell for help. Help! Help! Get me an AED! Call the ambulance! Call the police! Then I will continue. Now, the next thing is for me to go down to double shot. My cheek will go straight on top of the nose and mouth. My eyes will also focus on the chest to see if the man is breathing. The chest goes up and down while I feel the air that comes out of the mouth and the nose. Now, I'm doing this simultaneously. I have confirmed that nothing is happening. There is no sign of pulse. The man is not breathing. The next thing is to tilt the head towards me. Open the mouth. If there are particles, probably the guy swallowed something and blocked the airway. Right? Then I clear. Return the head nicely and slowly so that I don't injure him more. Then the next thing is, look at the man's nipple. My hand comes here directly.
This one comes inside. It's the heel that you will use. It's the heel that will give the pressure. The heel comes in between like this. You have to lock your elbow. Now, why do we have to lock our elbow? So that we can have the maximum strength. Full force. Thank you, sir. Are you a soldier, sir? Now, if you don't lock your elbow, this is what you'll be doing. Like this. You are breaking the strength. We need energy that will go in there. Like that is said, like this. You see, it goes straight down. Goes straight down. I didn't lock, I bend my elbow. If you break, you are distorting the flow of energy to the chest region. Are we following, please? Yes. Because this aspect is very important. This is where the main thing happens. Now you have to do 1, 2, 3, 4, 5. You have to do 30. Yes, you have to give 30. After giving 30, you would tilt the chin backward, slowly, so that you don't add injury to the neck region. Slowly, you raise it up, and then you pinch the nose. You pinch the nose. For training purposes, I'm not going to put my mouth here, but actually, I am to blow 2 breaths. Remember the definition? I'm to blow 2 breaths, full one, so that I will allow the first one, the chest to come up, and then goes down. I also blow the second one. I allow the chest to come up, and then blow. Then I continue. You are expected to give 120. You are expected to give 120. Now, because of health issues, so that you don't get infected, right? The last time that we got a circular, it was during COVID. During COVID, we were asked to continue giving chest compression until the arrival of ambulance or until the person revived. Why? You know, during COVID, we said everything, you broke your nose, you do this, so that you don't yes. So, it was advisable that we shouldn't do mouth to mouth. But if it's my daughter, my son, my wife, my mother, I'll do mouth to mouth. I'll blow. It's better my mom, my dad survive, right? But we were advised not to do mouth to mouth. There's a face shield. We forgot to go with face shield. There's a face shield that you have to cover the person's face. There's opening. Then you just blow through the face shield, so you won't get infected with anything that this person has. I hope this aspect is clear. Yes. It's very, very important for us to understand this. You put your hands here, and then you lock your elbow. Then the force comes from the upper region. Upper region. 1, 2, 3, 4, 5, and it's not fast like this. It's not fast. It's just tick tock, tick tock, tick tock, like this. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then I come here, right? Yes. Pinch the nose, and then you blow. Allow the chest to come up, go down. You come back again, pinch the nose, then you blow. Are we following? Yes. So, remember again, I'll continue. Now,
sorry.
When you are doing this, yes, please, sir.
Supposing the person was rescued from water, maybe he was drowning.
That will come to it. That's a different one. The person is drowning and you cannot swim. Just for him. We'll come to it. Thank you, sir. Now, I've demonstrated this, right? There's two man CPR. The reason why you have to shout it, in case somebody like me or doctor or somebody that has the knowledge of CPR, if he's passing by and he hears 1, 2, 3, 4, 5, 6, For me, if I hear such reading, I will jump down. So once I come, already she was gone attending to the man first. So this man came. So the person that has this knowledge, you must kneel down opposite the person in readiness. Just like this, in readiness. So once she finishes, she is going to the head region to give the 2 breath. So he waits for her. Once she finishes, then he continues while she rests. That is two-man CPR. Now, this man, Addison, has been resuscitated. Right? Now, doctor. So lie down. Lie down. Lie down. All right. Now we have reversed our master. Recovery position. Now, the importance of this recovery position is very, very vital. Now, oftentimes, when they are coming out of that situation, they cough. Oh. Now, if he's bringing out substance, and you fail to put him in recovery position that I'm going to give now, there's tendency, because he's unconscious, he does not have control of himself. He's going to swallow that saliva. That saliva goes in and blocks trachea. Trachea, right? Trachea. We call it windpipe, right? But trachea, it blocks it. And aside from that substance that is forbidden, this tongue is very big. This tongue you are seeing, this is our human tongue, it's very big. So if you allow him like this tongue will now block the trachea. Because he does not have control. He does not have, at this time, he only recovered. He just have some sense of respiratory now. But he's not still strong. So the tongue can block the trachea, and then he goes back to square one. I've experienced choking severally in my sleep. I swallow saliva. Saliva goes to one place, and all of a sudden I'll wake up. I'll start coughing because I know it. Once you get choked, no fear, just cough as hard as you can. It will clear. But when you don't understand that you need to cough, you will get choked, and then your system will start collapsing because you cannot breathe normally. You can't even breathe.
Yes, sir.
So anytime you get choked, cough as much as you can. Now for choking, we are going to take you through choking also. Now, for Pamata now, right? Now look at where I went down.
Is he alive?
Very wrong.
He's alive.
Look at what I did. Look at what I did. I pressed him to go down. Let me repeat. When the person is revived, look at what I did. I pressed him. I use him as a wedge to kneel down. No. The right thing is you go down, not using him to wedge your fall. Now, look at the position, right? I will tilt his head, right? Don't worry, you are just helping me, right? Now, then I'll raise this leg to this side, right? Then this arm comes in like this, right? Then I will now push him in, outward. Then I'll come here, adjust the head. Oh, relax. Just relax. Now, I'll put him in this position. The neck is not choked. Now, on his own, if he wants to move, this this knee will serve as a wedge. He will not fall down flat, face down. This hand will also wedge. Are you following? Now, if he vomits, it will flow. His vomit, everything will flow. So he's not going to take it back. The tongue is still normal. And then on his own, because he's weak and he's not strong, he cannot on his own fall backward. Are we following?
Yes, sir.
Do we now understand?
Yes, sir.
Then at this position, we leave him. We leave him until the arrival of the ambulance. At this time, he will sleep. He will sleep. Now, for infants, this is for adults. This is for adults. Do you also know that little ones, the infants, also go into cardiac arrest? They do. They do. So when you observe that the child is not breathing, you touch, you pinch the child, it's not breathing, don't be scared. Raise the child up. Put the face of the child facing you. You know they are delicate. Use your thumb to this compression anywhere in the chest. Use your thumb. Give 30 for the child. 30. 1, 2, 3, 4, 5. Or you put the child on the stronger hand or weaker or whatever. Let the hand serve as the hard surface. Use your 2 fingers or 3 fingers anywhere in the chest. Compress it 30. Are you following? Compress it 30. And then use your mouth to cover the child's mouth and nose at the same time. Blow air. Blow air. You start with S for them, because at that stage they need more air. They need more oxygen at that level. So you may start with breathing. You give solid air through the mouth and the nose. For adults, you pinch the nose, you blow air through the mouth. Are you following?
Yes, sir.
So we are going to now you see why I said earlier on you shouldn't start running. Help, help, help. No. Now look at number 8. 0 to 4 minutes. The likelihood of brain damage is what? Very slim. So the important minutes is that 0 to 4. Some are saying 3 minutes. The first 3 minutes. Very, very vital. So don't run and start calling people. Be with the person. And then here for that, I will assess the environment as safe for you and the victim. So let's look at the table. This table guides us and see why it's important for us to quickly go into action than running around. Because when you run around, you are wasting those first 3 minutes. Those 3, they are very, very important. So let me quickly talk about choking. Let me quickly talk about choking. Now, the universal sign for choking is this. The universal sign for choking. Can we all do this? This is the universal sign for choking. Now, anywhere you see someone like this, that person is actually choking. That person is looking for air. The trachea is blocked, so he cannot breathe. Now, I will come to him now. I will ask him, are you choking? Are you choking? Now, he cannot talk because he is struggling to breathe. But he's going to nod his head. He's going to nod his head. Are you choking? Do you need help? Yes. The whites were the one that trained us. So they will say you must always seek the person's consent. Do you need help? Yes, he said yes. Now, this is. Are we together?
Yes, sir.
I'm going to ask him to open his legs. I'll do like this, right?
Yes, sir.
I'll put my leg in between his 2 legs from behind, right? Then I will tilt him forward a bit, right? Are we all?
Yes,
I want to see you.
Yes, sir.
Now, the heel of my right hand, right? I'm going to slap him upward, right? Like this. Hard though, but his pulse is just class. But I'm supposed to hit him hard. Because to make him cough, that thing that is choking him, you need to stimulate him, you need to make him cough because when you hit him hard, he will cough, right? I'll give him 1 Yes, I'll give him. But actually, it's hard. You must give it just the way you are giving chest compression, right? Now, this is one side. Then I'll use my left hand. Look for his navel. I'll look for his navel. Then this hand comes above the navel. Then this other hand, right, goes above the left hand. Then I do what? Are we following? Yes. Then I'll give what? In, upward. Let me do it slowly. Hard in, upward. So this is what I'm supposed to do 5 times. Like this. Like this. It's because it's a class. But in real sense, I'm going to make him feel it and cough. Now, if your wife is heavy, if she's pregnant, just put your hand above, not here, above, and then you give her chest compression, then she will throw that thing out. I have a lot to cover. I'm sorry.
It is well.
So, can we take a few questions?
On the bed, for instance.
God has got
It's quite empty and
Thank you, sir.
you want the person to the floor or what? And then what if the person is heavily dressed, wearing a tie, a suit, or a brother or something? What do you do in this?
Good to be with you. Wonder, correct question, right question, very good question. From your question, actually, I know you know the answer. If it's darkly dressed, of course you need to listen as quick as possible. Because the main thing is that for this procedure, everything you are doing needs to be very quick. Even the assessment, he has done this, they said practice makes perfect. And I think that is what one of the elders have come to. We need to do these things as simple as it looks. It is actually very difficult when during that tension time. And let us all remember that this is not a doctor thing. This is an everybody thing. From Almajiri, for example, to the presidency, number 1 citizen. So it's supposed to be everybody, even the cleaners here, because you all know the reasons. We have been watching videos, films. These things could happen anywhere, anytime, without announcement. Your saving grace could be your house girl, could be your driver, could be your gate man. So for the proper dressing, you remove everything. You don't remember, don't think about any dressing. Of course, the chains should go off as quick as possible. Anything restrictive should be removed. And actually, this is a demonstration class, but you need to make the compressions as hard as possible. Permit me to say this. In the extremes of cases, fracture is allowed. Just to make sure that you administer and save the patient. Later on, doctors will take care of this fracture. The second question you talked about, if the person is on bed. Yes, sir. He actually gave a reason initially that because of the recoil, if you do it on bed, you'll be wasting your time. So it is better if you are alone, as quickly as you can, if you can grab the person to a hard surface, so that hard but safe place, so that you actually perform the compression better. Because on bed, you'll be bouncing with you, and all the energy actually is just dissipated.
In the case where you said CPR is administered to somebody who does not breathe at that moment. So, for instance, somebody is unconscious, and you can still see that sign of breathing. So what do you do?
If he's breathing and the policies
you cannot carry that person.
No need. You shouldn't. Unconscious patient, if you start doing that, because if, for example, to simply answer your question, all the patients who are unconscious in the hospital, are they performing CPR on them often?
Okay, like that. So what do you do?
You said?
What do you do? You just leave the person for
No, in that case, yours, as he said, help. Call for help. At that point, you see, some people don't know how to shout. For example, I have I hardly shout. But you need to, because of this thing, you need to learn how to shout. In that case, shout. You understand? If you remember as much as possible.
Let me give you one example. I was traveling sometimes in December at this international airport. So I went to the lounge. My protocol was to go to the lounge. So I was in the lounge with so many people. In front of me, there were some senators, elderly, in front of me, and then one Reverend Father, Catholic Reverend Father, in front of me. So we're like 5 in that corner that where I sat. So I was playing with my phone, and then they rescheduled my flight. So I relaxed. I was on my phone for a long time. By the time I raised my head up at the lounge, there was a lady at the reception there. And then I saw the other lady fanning her. She was just fanning her. Then that same lady that was fanning, she was calling her male counterpart that was attending to other people there. She was just, come. I said, this is not normal. I didn't know when I jumped over these senior people. I jumped over them, ran to that place. When I got there, that lady was almost gone. So what I did, there was no space for me to even balance. I just pulled her down. I told them, I said, look, I'm an expert. Excuse me, I'm an expert. I introduced myself. I pulled her from that seat down to the floor. I did less than 10. She now coughed. When she coughed, I prayed in my inner self. I prayed and I thanked God. And I put her in this recovering position. You know what the lady was asking me? What am I doing on the floor? I said, God just gave you second chance. That was what I told her. I kept her in this position. She was struggling with me. I said, woman, remember where you are. So I now asked our colleagues to call Fan Medical Unit. They should quickly come. And as they were about coming, the senators, all those people really, they were just coming to me. They wanted to ask me questions. As they were doing that, they just called my flight. That was how I ran and left. I've done my own part. So this thing can happen anywhere, anytime. And so, Prime Master, again, if you observe that the person is unconscious by their spouse, like he said, yell for help, quickly take the person to the hospital and put the person in a recovery position. Even convulsion, don't run away from them. Even convulsion, don't run away from them. We don't really have time to. We are supposed to talk on so many things.
What is the emergency call number? I think it was on the media recently. 112, but whether it's actually functional. And then also
you jump those senators.
Yes.
And then incidentally she's wearing hijab. What will you do?
And truly, I don't care. I don't care. All I know is one house.
Hello.
Yeah, I don't care. I was doing my job. I have the license. I got my license in US. I have my license. And again, I was doing that in a civilized place. It's not KB, it's not Sokoto, it's not Zamfara. It's not. I was doing it in the same place. And behold, when God through the help of the Holy Spirit, she was able to come back. And people heard me when I said God gave you second chance. I didn't say Allah gave you second chance. So I've done my own part.
Praise the Lord. The next question.
For permission from the relatives because of to minimize medical legal issues. These days, any nonsense can easily. Let me quickly chip in just maybe a sentence. Cardiopulmonary resuscitation. This is actually, as he said at the preamble, many people have actually mistakenly died. You know, many people. As God helps us and we come to do more of this, with this AED, you find out that some people in quotes actually died. But they came back. In fact, there are people who work in the accident and emergency, like in the US, who said some patients have died like 100 times, but came back 100 times. So with this exercise, but that will not go to that level. This is the basic point. Thank you.
My question is the application of the CPR. There are several steps.
That is done.
There are several steps to be taken.
Yes, sir.
What if you miss one or two of the steps? That's one. The second one is what is the AED?
Okay, that is what we'll come out. We'll talk about it.
Thank you, sir. Thank you so much. Electrical defibrillator. Now, sir, this is not exam. You must not pass 100%, or just do your best. As he said, internationally, there was even a challenge whether if you can only give compression and you don't give the breathing, just do something. Do something in the right position. So as far as of course, as I see You know, some people, maybe they will not. But however your energy can take you, please do. Thank you, sir.
Praise the Lord. I know it's getting more and more interesting, but for time factor, we'll have to stop here. By God's grace, we are trusting God that we'll come again next week to continue. Like they say, practice makes perfect. So we'll practice it again, and then there will be more slots for questions. And one thing that we are proud of is the fact that we are blessed with medical professionals that are of renowned medical practitioners with very long experience. So there will be room for more contributions, even as more questions will be given. And please, that they are making the presentation does not mean that our experts cannot also chip in and also give their own perspective. So we are trusting God. We'll start early next week, and we'll have more time for demonstration and more time for question and answer. But I trust that we'll be blessed this evening. So let's thank God for the much we've learned, and then trust that when the opportunity comes, beyond what the doctors can do, the Holy Spirit always takes the ultimate place. He leads us, He guides us, He strengthens us. The Bible says He teaches us all things. That is one of the functions of the Holy Spirit. So we always rely on Him and not on our own strength. And He will help us even when the opportunity arises and when the need comes. We say thank you to all our doctors.
Let me quickly add to Daddy's question. Of course, wherever, that's why the help comes in. Collaborate. If you reach where you can't remember, keep on shouting for help so that somebody else will come and then you know.